Hello, doctor. My name is Raja Ani Nurin. I will be presenting about otitis media. But first, we get to know about our ears. So our ears contain three major areas, which is the outer ear, middle ear, and inner ear. In the outer ear, we have the earlobe, the helix, temporal muscle, temporal bone, cartilage, and the ear canal. In the middle ear, we have the tympanic membrane, tympanic cavity, and some components called malleus, incus, and stapes. In the inner ear, we have the eustachian tube, cochlear nerve, vestibular nerve, and cochlea. So the main functions of our ears is to maintain our sense of balance and hearing. It is also the receptor and filter of our auditory senses. Now I will be introducing about otitis media. So otitis media is mainly an inflammation located in the middle ear. There are three types of otitis media, which is acute otitis media, AOM, otitis media with effusion, OME, chronic otitis media with effusion, COME. So for AOM, it mostly occurs in young children, especially during winter season. It is an inflammation of the tympanic membrane and caused by bacterial infection. For the OME, it contains non-infected fluid in the middle ear caused by the cold, sore throat, and respiratory infection. As for COME, it is caused by eustachian tube dysfunction, and it gives the sensation of fullness in the middle ear and can cause pressure in the middle ear. So, to know the symptoms and causes of otitis media. There are many symptoms and causes, but these are the main ones. First, you have the sensation of ear pain, irritability, and loss of balance. As I mentioned earlier, the ear is responsible for maintaining our balance. And otitis media is caused by eustachian tube deformation. This is mostly for COME, and cold can cause AOM and OME. To diagnose otitis media, first we have the otoscope. This is the otoscope, tympanometry test, acoustic reflectometry, and the doctors will mostly check the patient's history if there's any ear infections prior to the otitis media. So otoscope, it will be the ear speculum will be inserted into the external ear to check the ear canal and eardrum. The tympanometry will test how well our eardrum moves. It has a small probe here, and this small device will be attached and will push air into the ear. So the result will be shown in the graph here, which is called tympanogram. Next, we have the acoustic reflectometry. This is basically an acoustic otoscope. It measures the reflected sound from the tympanic membrane. So the louder the sound is, that means there are more effusion in the middle ear. Next, we move on to the treatment of otitis media. First is the removal of adenoid. This has been proven to help children a lot. This is the adenoid. Eardrops can help to reduce the bacterial infections. And laryngotomy. Laryngotomy is a procedure where a small incision will be made in the tympanic membrane, and a tube will be inserted to drain the fluid out of the middle ear. To prevent from getting otitis media, it is best to get pneumococcal vaccine. This will protect an individual from getting pneumococcal infections. Next, it is also good to avoid cigarette smoke. And as for infants, it's good to avoid using pacifiers, as this can cause bacterial infections if it's not cleaned regularly and properly. The prevalence of this disease mostly occurred in children from 6 years old and to adults up to 36 years old. It occurs in the cold climate and cities or any places with a lot of pollution. And that is all for otitis media, and thank you so much. Bye.